Herbal medicines are a type of dietary supplement used by consumers to maintain or improve health. They are commonly sold as capsules, powders, tablets, teas, extracts, and fresh or dried plants. They are also known by the term botanicals or phytotherapies. Herbal medicines were also found to be the most commonly used complementary health approach in three studies performed in 2002, 2007, and 2012. Herbal medicine is one of the oldest forms of complementary and alternative therapies. The first evidence found of its usage was a recipe for 12 herbal preparations carved in a slab of Sumerian clay that dated back approximately 5,000 years ago. In 2500 BC, Emperor Shen Nung wrote the Pentateuch, which documented over 365 medicinal plants and herbs. Throughout history, mankind has continued to experiment and search for new herbal remedies to improve health and well-being. The following table lists the 10 most commonly used herbal supplements in the United States. For example, echinacea is used to treat colds, flu, and to strengthen the immune system. St. John's wort is used to treat mild to moderate depression, and ginkgo biloba is used for poor circulation and memory loss. As the use of herbal medicine continues to be on the rise, issues regarding the safety and efficacy of therapies must continue to be examined. The general public and even medical professionals often lack the knowledge about interactions and toxicity. It is important to understand that even though herbs are natural, side effects, adverse reactions, and even toxicity can occur. Current regulatory practices can lead to issues with contamination, adulteration, and misidentification. One study performed to examine the level of toxic element contamination of natural health preparations found that many supplements contained some toxic element contamination, while a small percentage contained toxic element levels above recommended daily standards. These issues have led many healthcare professionals and healthcare consumers to oppose the use of herbal medicine, feeling that the risk involved far outweighs the benefits. For example, an individual with high cholesterol could opt to use a garlic or soy supplement, which has been shown to reduce cholesterol by 4 to 6% with limited data available on safety, or they could use a statin drug that can reduce cholesterol by 17 to 32% and has unlimited data about safety and its effects on cardiovascular disease. The trend of healthcare consumers seeking more natural approaches to managing chronic illness and improving their well-being has pushed researchers to look closely at the efficacy of herbal remedies. One such systematic review was performed to evaluate the effectiveness of Oriental herbal medicine as a treatment for general anxiety disorder. This study evaluated symptom improvement when Oriental herbal medicine was used versus a placebo. It also looked at the effectiveness of Oriental herbal medicine with and without Western medicine. Listed here are the 10 most commonly used herbs in the evaluated studies, with Pariah coccus being the herb that was used most frequently. The conclusion of the study showed that Oriental herbal medicine reduced anxiety symptoms more when compared to a placebo or Western medicine alone. This topic could be viewed as somewhat controversial, as traditionally Americans turn to Western treatments such as selective serotonin reuptake inhibitors, anxiolytics, and antidepressants to treat general anxiety disorder. I would not be opposed to a patient using Oriental herbal medicine to treat the symptoms of generalized anxiety. To me, the most important issue is that the individual is achieving positive results and that they disclose the use of herbs and supplements to avoid possible interactions. Many anxiolytics are habit-forming, and antidepressants along with SSRIs can have unpleasant side effects that lead to noncompliance. In comparison, this study showed relatively few side effects associated with the introduction of Oriental herbal medicine. I am open to the use of herbal medicine, and I look forward to seeing what is uncovered in the future. My only concern is the lack of regulatory standards. By making sure herbal supplements undergo the same safety testing required by over-the-counter medicine, requiring that all claims be supported by the FDA, and ensuring product labels have a full listing of ingredients would go a long way in improving safety and proper usage of these products.